Welcome to the Essence of Health Tea Time podcast. I am your host, Dr. Shayla Toombs-Withers. As a double board certified family and obesity medicine physician with over 12 years of experience in medicine, I teach motivated individuals how to achieve their desired quality of life while preventing and reversing chronic diseases. It's tea time. On today's episode of the Essence of Health Tea Time podcast, I have a special guest, Dr. Sarah Boyles. Dr. Boyles is a board-certified urogynecologist with more than 15 years of clinical experience treating women with pelvic floor issues. She is a specialist in the field of obstetrics and gynecology and has completed additional fellowship training in female pelvic medicine and reconstructive surgery. Dr. Boyles has published extensively in her field and has been active in creating quality standards nationally through the American Urogynecologic Society. She has been a top doc in Portland every year for the last 7 years and loves her clinical practice. She is passionate about educating women on their pelvic floor and especially urinary incontinence. Her goal is to help women understand why they are leaking and recognize the spectrum of available and proven treatment options. Thank you, Dr. Boyle, for being on the show. I'm so happy to have you today.
Thanks for having me. I'm so happy to be here.
Awesome. So we're going to dive right in here. So just give us a bit of background. When do women typically go through menopause? Can you just explain for us what perimenopause is and how it differs from menopause? And then what are some of those more common symptoms that you typically encounter?
Yeah, so great question. So menopause happens on average at age 51, and we define menopause as when you haven't had your period in a year. Right. So that is officially menopause. But before menopause, there's this period that we call perimenopause. And perimenopause is when your ovaries aren't working as regularly as they used to, and your hormones can be all over the place. Right. So when we're in our mid-20s or mid-30s, our hormones are pretty cyclic. Usually for most people, they're pretty regular. You follow a pattern. But then in your 40s, you stop following a pattern because your ovaries just aren't consistently making estrogen. And so you can get symptoms that are kind of all over the place. And the important thing to know is, that can be up to 10 years before menopause, which means that, women in their early 40s, sometimes their late 30s, can start having some hormonal irregularities that they may not be anticipating and that people aren't really talking about, right? I think at that point in life, you're not always, that's not on your radar, right? That's something that you associate with being much older. So the common things that we see in that time frame, so the most common symptoms with menopause are really hot flashes and night sweats, things like that. But in perimenopause, you can get a little bit of that. You can get a little bit more irregular. But you can also get a lot of vaginal and bladder symptoms. So you can get more urinary tract infections. You can feel like you have a urinary tract infection, but it's not actually because of bacteria. It's not an infection, but you're kind of getting all of those same symptoms. So urgency, frequency, lots of burning. So burning in the vagina, burning in the bladder, just, discomfort. Things that, you kind of try to ignore, blame on other things, maybe the heat, maybe something you ate, we all like to try to explain things away. But those symptoms can all be because of declining estrogen. And then, when estrogen levels go down, you get decreased lubrication in the vagina, which is what leads to some of that discomfort, but can also lead to more uncomfortable intercourse, which some people are comfortable talking about, some people aren't comfortable talking about, but can definitely happen at this time as well.
Yeah, thank you for explaining that. And for the audience, I hope they, are really listening. And another take-home point I'd like to make as a family doctor, I often get people who walk in and they're like, well, my hormones are out of whack. And you're like, okay, let's narrow this down a bit.
Yeah.
Yeah,
Right. I mean, I
so
think
much.
as women, we blame things on our hormone, or other people blame things on our hormones. And sometimes it's your hormones. Sometimes it's hard to figure out what's going on, right? Because there are so many other things that can be happening. But
Right.
sometimes it really is the hormones.
Yeah, for sure. Yeah, so good to point out all those different symptoms. And then are there any other like more surprising things that you find that a lot of people just typically don't realize that can be related to those perimenopausal symptoms?
I think the urinary tract infections are kind of the big ones, right? That women don't really think about. You can also get a degree of brain fog and fatigue. And I think those symptoms are really hard because there's so many other things that can cause that.
Yeah.
And we don't typically think about hormones, right? We think about maybe not
Maybe as
sleeping
simple
well
as right,
enough,
fatigue. Yeah.
right? Our kids bugging us, our husband bugging us, work, but sometimes there is a hormonal reason that can be contributing as well.
Yeah. And now, in the field of obesity medicine, which I am, weight gain is commonly another concern for some women going through perimenopause. So, what are some of those hormonal factors that may be contributing to these weight changes? And then, what lifestyle adjustments do you typically recommend to support a healthy weight accompanying these hormonal changes?
Yeah. So you're right. With declining estrogen, you can definitely get some weight gain. And even if you're not gaining weight, the way the weight is distributed can be different, right? Where you tend to get more weight around your middle and less kind of in your hips and legs. So your shape can be different. And that's something that, we all kind of hate and don't really want. The recommendations that, I have for maintaining a healthy weight, it's not glamorous, right? It's all the hard work where you need to move more. You need to be careful about calories. You need to make sure that you're sleeping enough, right? All of those things support a healthy weight. And then being really careful about things like extra sugar and alcohol consumption, right? Which can
Right.
definitely lead to increased weight and is something a lot of people use to, we'll say, slight excess with the best of intentions.
Right. Yeah. And then I'll just even piggyback off of that with you talking about the abdominal weight gain. We know there are studies now that have shown that that can actually increase our risk for heart disease and cardiovascular risk factors, especially amongst women who are already getting those increased risks just due to age. And so, as you said, it is really important to focus on those lifestyle changes.
Yeah.
Yeah.
And I feel like, when you're younger, you can have some bad habits and get away with it. But then as we get older, those bad habits catch up with us, right? And you can't really get away with it anymore. And so then you do have to be really careful about what you're eating, the amount that you're eating, the types of food, and how much you're moving. And, weightlifting to maintain your bones is also, such an important part of aging gracefully.
Yeah, it is. And I feel that's another thing we as women a lot of times miss because you think of weightlifting and you think of the folks with the muscles just popping out here and there. And you're like, oh, I may not even necessarily want to look that way. But you're so right. Weightlifting has other benefits, for
Mhm.
our bone health and our health in general. So, yeah. If you're frustrated with your weight, taking more medications than you'd like to, have been told that you are at risk for the development of a chronic preventable disease, or just are not feeling in the best of health, then I'm talking to you. Why? Because you're tired of fat dieting. You know it's time for a change, and you want a sustainable plan to improve your health. If you have found yourself at this place in life, well, I have developed a program that's just for you. It's called The Essence of Health, and it's your prescription for transformation. My goal with this program is to give you the tools needed to create sustainable lifestyle changes within a group coaching setting, along with one-to-one individualized coaching to give you a personalized path to health that's just for you. The benefits are priceless, so join today. Head on over to eohcoaching.com to learn more. The essence of health is in you. Now that we know all of these symptoms to be looking out for, what are some of the available and beneficial, I will say, over-the-counter treatments for these menopausal symptoms?
Yeah. So there are different moisturizers, vaginal moisturizers that are available over the counter, some of them with prescription, and that can definitely help. For the dryness, estrogen works the best, but that's prescription and that can be expensive. And some people don't want to use vaginal estrogen. And then so using a lubricant can help. We frequently recommend coconut oil. For women who are getting a lot of urinary tract infections and they want to be on a preventative and they want to be on a more natural preventative, you can use D-mannose, which can help minimize urinary tract infections. It only works for E. coli infections, but that is a natural supplement that can help quite a bit. So, for vaginal and bladder symptoms, those are the big things that I would recommend.
Yeah. And what are your thoughts on cranberry? We get asked that one a lot. Should I just
I,
drink a
you know,
bunch of
I,
cranberry
I'm
juice?
completely neutral on cranberry, right? So when I have people come in and they're on cranberry and they swear by it, I don't take them off of it, but I very rarely put people on cranberry. I feel like every year there's a big study that says it works a little bit, and then the next year there'll be a study that says, it's not really that beneficial. So I don't actually do a lot with cranberry. But,
Yeah.
for those people who swear by it and feel like it really works for them, I think that's fine. The big thing that I would encourage women not to do is to drink a lot of sweetened cranberry juice, right? Sometimes people think
Right.
that that's a good idea, and that doesn't really help. You can't get enough cranberry, and you're getting an awful lot of calories and sweetener.
Yeah. Yeah. And that sugar can actually put you at
Yep.
increased risk of getting those UTIs versus what
Yep.
you think. So yeah. Yeah.
Exactly. And I think that's something that a lot of people do with the best of intentions, and it's just not achieving what you want it to.
Right. And then I love that you pointed out coconut oil. I often tell folks, put the coconut oil on your skin, on your hair. Don't
Yeah.
put it in your body. So I totally agree with that. Coconut oil is so high in saturated fat. So from a health standpoint, internally, it's not the best. But yes, it's great for skin and for the vaginal tissue. Seems like what you're telling us.
Yeah. And a lot of women just notice a huge benefit from that, right? So, especially if you're just having a little bit of dryness or a little bit of vaginal irritation, that can make a huge difference. And it's, readily available, easy to get, easy to use.
Yeah, yeah. And now, so we've heard so much in the media, and women even talk amongst themselves about hormone replacement therapy. And so, when should a woman get to that point of even discussing these prescription treatments like hormone replacement therapy?
Yeah, so it's funny how there are fads in medicine, right? And 20 years ago we put everyone on hormone replacement therapy, and then a couple of studies came out and we said nobody should be on hormone replacement therapy. And now we've really dialed that back, and you should consider hormone replacement therapy if you have bothersome symptoms, right? So some women go through menopause without a problem, or they have hot flashes for a very short period of time. If you don't consider it to be a problem, if it's not bothering you, you absolutely do not have to be on hormone replacement therapy. So the degree of bother, I think, is important. Sometimes that's a little bit hard because you have to convince your provider that you're bothered enough, and so there's a little bit of a subjective lens there. But if you're bothered by it, then it's a totally reasonable thing to consider. And then with hormone replacement therapy, you want to start it within 10 years of menopause, because that is the safest time. If you've been off of hormones, right? So you stop making estrogen and you haven't been on any replacement for 10 years, then that's a point in time where the risk is greater if we start it. So we don't start systemic estrogen. I shouldn't say don't, but the risks become greater at that point in time. So the risks start outweighing the benefits. So it would have to be a very unique situation.
Yeah, yeah. And then can you just share with us what are some of the latest guidelines when it comes to the hormones and cancer? Because that's, another common thing that people are consistently concerned about.
Yeah. So if I see a patient in clinic and they have just vaginal or bladder symptoms, then I will start them on vaginal estrogen. And the reason that we start with vaginal estrogen is because you need it in the vagina, right? Or in your pelvis, and it will get absorbed into the bladder as well. But you don't need it in the rest of your system. So when we give you that local estrogen, it really stays in that area. And if you're taking it at the, prescribed amount, then your blood levels of estrogen will actually stay in the menopausal range. And so there's no risk of heart disease or cancer, or, I mean, the risks with vaginal estrogen are really, really minimal. So that's very safe. And we even have patients who have breast cancer, and we always do this with their oncologist. But for women who have breast cancer and have bothersome vaginal symptoms, we'll put them on vaginal estrogen. Now, everyone has to feel like that's a good idea, right? Sometimes when you've had breast cancer, that just doesn't feel great, even if it helps with the symptoms. So it's a long conversation, but it is safe to do it. So, if we can give you vaginal estrogen, we do that. And then, in terms of breast cancer, when we give you oral estrogen or a patch, it doesn't actually increase the risk of breast cancer. If you have a breast cancer, it can stimulate growth, right? And so you might notice it a little bit more quickly, but it doesn't actually increase the risk of breast cancer. So it's felt to be very, very safe. And there's more and more data coming out about that all the time.
Awesome. Thank you. Now, so for all of those other kind of pesky hormonal feelings that we get even outside of menopause, what are just a few tidbits that you can share with the audience?
For controlling all of those symptoms, I think the first thing is recognizing, kind of your own system and how your own system works, right? And when your estrogen levels are high, when your estrogen levels are low, right? They're the lowest right before you have your period and when you're menstruating. So just recognizing your own cycle, right? And how you feel at different points in time, because it is different person by person, right? And when you kind of recognize your own cycle, you can, if it's a time where you're a little bit grouchier, which definitely happens, you
Yeah.
you can, adjust things a little bit, keep yourself away from people, maybe exercise a little bit more. So I think recognizing your own cycle is important. And then, for so many of us, I think being active and exercising is really important to help, just kind of support your mental health and your feelings at that point in time, right? So I think really being aware of your own system and what your system does is so important. And it always amazes me how little we all know about our own bodies, right? And what's actually happening at what point in time and why I really feel this way, right? So
Yeah,
I think
yeah.
education is the key.
Exactly. Yeah. So, keep listening to Essence of Health Tea Time so you get all of this educational advice and then listen to your body, like Dr. Boyles is telling you.
It's true, I mean, I even little things like I do a certain number of hysterectomies, and I was talking to a young woman the other day and I said, well, I'm going to take out your uterus, we're going to leave your ovaries, and then your hormones will be the same, right? I mean, taking out your uterus has no impact on your hormones. And that was new information for her, right? She hadn't realized that. And I think that's really common,
Yep.
right? But we just don't realize how those parts work. We just want
Right.
them to work and
Yeah,
not
it
have to think
is.
about it too much.
Yeah, yeah, so true. And then, we'll chat just a bit about those other low estrogen states. So when people may have some of these hormonal changes, whether they're on types of contraceptions that may be hormone based or even breastfeeding, tell us a
Yeah.
bit about how those things make and bring about some changes.
Yeah. So, I mean, I think that's a great point because those aren't things that we necessarily talk about, right?
Yeah.
So, there are different types of birth control. I mean, the big things that cause it, I mean, you can have early ovarian failure. But in general, the things that drive down your estrogen are hormonal contraceptive, right? So IUDs can do it. The Mirena has progesterone in it, and it can absolutely drive down your estrogen level. Birth control pills can do it. And breastfeeding is also a big time. So a lot of women will get kind of these irritative vaginal and bladder symptoms when they're in the postpartum period, right? Because it's not uncommon to have an IUD and be breastfeeding, have these symptoms, be at home, be too busy to actually be able to address it, right? Because you're figuring out a lot of things at that point in time. But those symptoms can be super, super irritating. And so sometimes at that point in time, we will give women vaginal estrogen to support them. I mean, that's a totally reasonable thing to do. It's safe for the baby. Definitely something you should talk to your physician about. And then the same with different hormonal forms of birth control, right? Where sometimes we have to supplement and give a little bit of estrogen, maybe vaginal estrogen. Sometimes we have to try a different type of birth control where the ratios of the estrogen and progesterone are different. And sometimes the side effects, the symptoms that you're getting are just too bothersome to you, right? And that's not a great form of birth control for you. But I think it's always a big conversation. You're weighing a lot of things. I don't like women to stop breastfeeding, because of that low estrogen state. It's nicer if we can support you and you stop breastfeeding when you want to stop breastfeeding. And then, I think birth control is a very important thing for a woman, and it's important to have birth control methods that work for you and support you. So, those are all things that we have to figure out.
So true. And nowadays we have so many birth control options. And so, like you said, it's definitely not a one size fits all approach.
No.
Yeah. And just for women to keep in mind, there are, so many options out there, and just, be willing to try and work with your physician. Yeah.
And it takes a little bit of work sometimes, right? To find the method that kind of works for you, because your body may not have read the book. You may have some side
Right.
effects that are a little bit unusual, right? And you just need to try a couple of other things, and that's okay. And it's I don't know what your practice is like these days, but sometimes medicine is not convenient, right? It's hard to make appointments. It's hard to get in. It can be hard to talk to your provider, just because it feels like the system's a little bit gummed up these days, right? Things aren't moving through really smoothly.
It definitely is that way in traditional practices, but mine's is not. It's one of the reasons why I opened my practice. So,
Ugh,
yeah.
I'm so jealous.
See all of my patients for an hour. We sit, we chat. They have my personal email and a cell line to text me, so they don't have to worry about those things.
Yeah,
It's
so then
part of the care,
that's
the way that I
perfect.
want it to practice. So yeah.
Yeah, but I just think even if it's inconvenient, it's so important to follow up and
Right.
say, hey, this isn't quite working for me, right? I mean, having your hormones be, I don't know, a little bit off can be a huge quality of life issue, right? And can impact you on a day-to-day basis.
Yeah, for sure. Well, thank you so much, Dr. Boyles. This has been fantastic. You've provided some very good information within women's health for our audience. Now, how can my audience connect with you more? I do know you also have a podcast, so tell us a bit about that and how they can connect.
Yeah. So I started a podcast. My podcast is pretty new. I started in February this year. It's called While You Wait. And I mean, this is actually the perfect segue. I created it because patients were having to wait a long time to get in to see me. And some of my referring providers said, hey, what can we do to support these people while they're waiting? Because there's, a little bit of frustration. And so I just addressed the things that I would like people to know before they come in about bladder health, about hormones, ways to help you get started if you're having pelvic floor issues.
Yeah.
So, and it's been super fun so far. So, and it's available on all of the normal, podcasting venues. And then I have a website, and I'm available on social media at the Women's Bladder Doctor at the Women's Bladder Doctor.
Awesome. And I'll be sure to put all of that in the show notes. But yeah, thank you so much for coming on the show today.
Anytime. It was fun.
Thank you for joining me today on the Essence of Health Tea Time podcast. Click the subscribe button on your favorite podcast platform so that you never miss a moment of the Essence of Health Tea Time podcast. Check out the show notes to obtain your free tips for healthy living guide to get you started on your health and wellness path. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, and at dr.tw@EOHWC on TikTok. Interested in becoming a member of the Essence of Health coaching program? Well, head on over to www.eohcoaching.com. The essence of health is in you.